My name is Carrie Farmer. I'm a senior policy researcher at the RAND Corporation. The briefing today was about a summary of our work that we conducted under the Veterans Choice Act, where we examined the supply of VA healthcare, demand for VA healthcare, and how VA purchases care in the community. Over time, the current VA patient population will become older and will have even higher rates of chronic conditions. At the same time, the size of the post 9/11 veteran population will increase as a proportion of the overall veteran population, and little is known right now about their long-term needs. Veterans will also move across the country, so there are some areas of the country that will experience an increase in the number of veterans, while large areas of the country will experience a significant decrease in the number of veterans. VA has long been a leader in the measurement of the quality of care, and many studies have found that the quality of VA care is good. We compared VA to private hospitals, to commercial HMOs, to Medicare, and found that on most measures, VA provided care that was as good or better than other health systems. We use VA data to project the expected demand for care over the near term, so over the next 5 years, and compared that with VA's assessment of the projected supply of care. And what we find is that there is a gap in care that will persist over the next few years. There are a number of policy options that policymakers might consider to increase access to care for veterans and to meet demand. Among those include hiring additional physicians, providing full practice authority to advanced practice nurses to make the best use of those medical professionals, making better use of telehealth, and paying for care in the community in a strategic manner. VA has been purchasing care in the community for some time. In recent years, the amount of care that's purchased in the community, both measured by the number of veterans who are receiving care in the community and the cost of that care, has been increasing. And VA's budgets for FY17 and FY18 indicate that this is an expected increase as well. Congress and VA are currently considering ways to consolidate purchased care so that there is a coherent program for purchased care. What we recommend is that policymakers really think closely about what are the objectives of purchased care, how is purchased care intended to fit into an overall strategy for providing care for veterans, what are the objectives of purchased care, and develop a clear strategy. And that any future direction in expanding purchased care is really in alignment with an agreed upon strategy.